Hi, everyone. Welcome to the public meeting by the California Air Resources Board, or CARB's, research division on proposed concepts in cumulative impacts research. We're thrilled that you've been able to join us today. Thank you for making the time. We've intentionally reached out to folks from broad academic research and community expertise in the hopes of having an informative and engaging discussion on research gaps CARB can address in cumulative impacts. So as I mentioned, we are recording today's session. You can turn on live automated captions using the Show Captions button from the Zoom menu at the bottom of your screen. I'm showing that button in the box, in the red box here. Your menu might look slightly different than the one in the picture. So to keep things on time, we'll mute everyone and get through a presentation first from our staff, and then you'll have a chance to verbally ask questions right after. If you have questions during the presentation or hear terms that you didn't understand, please let us know through the Q&A. Our staff is monitoring that. We'll respond to as many as we can right away or during the Q&A. If you post questions to the chat, I can't guarantee that we'll see it because we're going to be monitoring the Q&A. If you don't see either the caption or Q&A options, click on the More Options with the three dots all the way on the right to expand the menu, and you should see captions and the Q&A in the window that pops up. And last housekeeping item, I am going to ask that if you're an attendee from CARB or another California state agency, please indicate that in your Zoom name so our community and external participants clearly see who they are speaking with. All right. You'll hear from several presenters today, including Bonnie Holmes-Jen, this Chief of CARB's Health and Exposure Assessment Branch. Me, I am Pradeep Pradipa, and I manage the health analysis section. And most importantly, from Joshua Motafakon, who is leading this work. We're also joined by facilitators Lamika Castillo and Diana Sarabia Bocinio.
Thank you so much, Pradeep, for the opening and welcome. Good morning, everybody. My name is Lamika Castillo. I use she, her, aya pronouns. I am co-founder and principal of Castillo Consulting Partners, and my colleague Diana and I are your facilitators for today's conversation. Members of our Castillo Consulting Partners team have facilitated a diverse array of public meetings and discussions pertaining to community air protection with the California Air Resources Board and various air districts across the state of California for about, I think, almost 5 years now. And it is our honor to support the facilitation of today's meeting, which will be an interactive discussion regarding research priorities on cumulative impacts. Now I'll hand it over to Bonnie for opening remarks.
Morning. And again, I'm Bonnie Holmes-Jen, and the branch chief for the Health and Exposure Assessment branch that's putting on this workshop. And I want to also welcome everyone. And just a few comments. At CARB, we are committed to expanding our understanding of the health impacts of air pollution and climate change. And this includes researching many factors that impact health in communities and can worsen air pollution effects. At CARB, we have been calculating health benefits of our rules and programs for years using scientifically sound tools. Our health calculations that quantify the health harm of air pollution are built into every rule and program that goes before the board. But we know we are not capturing the full extent of pollution impacts across diverse communities, and we want to learn more about this. While the current US EPA has stopped work on directly calculating lives lost and increases in hospitalizations and medical costs from pollution. In contrast, CARB is stepping forward to advance our work in this area as federal efforts have slowed. In California, we're committed to expanding our knowledge of air pollution impacts and the analytical tools we can use using strong scientific evidence. And then we use that information in our public policy and rulemaking efforts. So that's why we're holding this workshop. We are looking forward to investing a portion of our research funds into better understanding cumulative health impacts and building on existing frameworks that we'll be discussing today. We appreciate your time and engagement in the workshop. We're looking forward to hearing all your input on our research concepts. We're at the beginning in some we're at the beginning of a process, and we're presenting these concepts to get input, and we will be continuing to meet and discuss as we get requests from people who may be attending today. And we appreciate the help of our facilitators at Castillo Consulting Partners. So I'll turn it back to Lamika, or Lamika, correct?
Correct. Thanks, Bonnie. So yes, your insight and perspectives are so important to this conversation. And before we dive into the conversation, we'd like to share who is in the room today based on the RSVPs that CARB received for this meeting. So as cumulative impacts affect everyone and CARB is interested in collecting feedback and ideas from diverse stakeholders, the research team, as Pradeep shared earlier, invited a broad list of organizations and individuals to join today's discussion. Here's a snapshot of who we have in the room. So about half of our attendees or folks who RCP'd are from California state or local agencies like air quality management districts. 1 in 5 are researchers from academic, private, or government organizations. We have over 30 community-based organizations from California and about the same number of industry or trade organizations represented today. About 20% are attending a CARB public meeting for the first time, so welcome. We're so excited to have you if this is your first time, and even if it's your fifth time or your 50th time. We always welcome the participation of folks in these public meetings. As you can see, we've tried our best to accommodate the breadth of everyone's background. You'll see, as you will see in the presentation, we tried to accommodate the breadth of everyone's backgrounds. So now that we have an idea of who is in the Zoom room with us today, we'd like to get a better sense of why folks are here. We have a brief icebreaker question, and you can see it up on the screen now. And the question is, why did you decide to join our conversation on research priorities and cumulative impacts today? In essence, what is the primary reason you decided to attend today's meeting? Are you here because you want to learn more about cumulative impacts? Did you join to share your thoughts regarding the research priorities needed to address cumulative impacts? Are you hoping to gain insight about what CARB is doing to address cumulative impacts here in California? Is your goal to gather information about CARB's research solicitation for cumulative impacts that's going to be put forward in a couple months? Or have you joined for another reason that's not listed? And if so, please select other. So we are going to open up a poll. It should have just popped up on your screen. And when the poll comes up, we ask you to please select the one that reflects why you've joined today's meeting. And we'll give it maybe a minute or so here. I see lots of results coming in. Thank you so much for participating in this brief icebreaker. And in a few more seconds, we'll share the results. Great. This is excellent participation. It looks like already over 100 people have shared responses. So thank you again for taking a few seconds to share why you've joined us today. All right. It looks like I think we've gotten over 100 responses. So let's share the poll. Oops, sorry. I think someone else clicked on share. Can you all see the results here? All right. So look at that. We have 35% of you have joined because you just want to learn more about this topic. Well, there's a lot to learn, a lot to be discussed today, and the presentation that Pradeep and Joshua will share, I think will help meet the need for those of you who joined to learn more about the topic. 15% said you're interested in giving feedback on research gaps. Thank you so much for being here because ultimately that's one of the biggest goals of this meeting today is to get that feedback on where can the research become more robust so that we're actually able to identify more resources and ways that we can address cumulative impacts and tackle it head on. The largest percentage here, 70%, want to understand how CARB is addressing cumulative impacts. So again, the presentation that you will be receiving in a few minutes here, I think will help to provide more insight and share, more about what's going on at CARB related to cumulative impacts. 27% are here to learn, hear more about the research solicitation, and we'll also talk about that toward the end of the meeting. And then some of you put other, you had another reason for joining. So we'd love to hear more about that from you as well later today. Unfortunately, the poll doesn't give us the option for folks to put in their own response. But if you're open to sharing that when we get into some breakout rooms later about why you joined, we would love to hear from you. All right. So thank you all for participating again. And we're going to move forward now with an overview of what we're doing for today's workshop. So, as was already mentioned by Pradeep and Bonnie, our goal today is to introduce CARB's cumulative impacts research priority and share research concepts that the research team is proposing and gather your input to help refine the scope and direction of this work moving forward. So that feedback is really a really critical piece of today's meeting. Next, we want to make sure that everyone has shared vocabulary and understanding of cumulative impacts. So we'll cover working definitions and why the research division is focusing on this particular issue for this solicitation. Next, we'll share the process that the research team has used to engage subject matter experts in the months leading up to today's meeting. And then we'll walk through 4 prospective research concepts that the research team has developed based on some discussions that they've had with experts, including community leaders, academics, researchers, and other agencies. After presenting the concepts that have come forward, we'll have question and answers, then move into breakout rooms for guided discussions that will give everybody here an opportunity to share your feedback and thoughts on what you believe research gaps are and things that you would like to see CARB consider as they develop the solicitation. We'll close out the meeting with next steps, including how your feedback will shape the project, and then also what you can expect with the solicitation process from now until the solicitation is put forward to the public. So those are the objectives and the agenda for today. Excuse me, I can't say this enough. The primary goal of our meeting is to gather feedback from you all. So many of you are here because you want to hear from CARB, and I know that that's typically how these meetings work, but really CARB is wanting to get your feedback and to hear from you. So it's supposed to be a conversation rather than just a presentation. And so we want your feedback to shape the scope of the work of the research solicitation on cumulative health impacts that CARB is going to put forward. CARB is interested in identifying concerns that affect all communities and is especially interested in gaining deeper insight into sensitive areas such as children and older adults and our state's most vulnerable populations. We know that each stakeholder group has valuable insights and unique perspectives to share that will shape this critical research. And so we want to know things like which concepts that you'll hear later in the presentation would address your concerns about air quality and health in your own community. Also, we want to know where do researchers, excuse me, where do researchers believe resources should be allocated to effectively advance the science of cumulative impacts? Things like that. And there are going to be a lot of other questions that we will pose to you when we get into those breakout groups in just a little bit. We truly value the contributions of each person here, and we want to we want to assure you that your participation as a researcher or community organization will not exclude you from applying to the solicitation. So please do not hesitate or hold back in sharing your feedback that to shape the solicitation, because your insights are absolutely invaluable and they will not preclude you from being able to apply should you be interested. Now that we're all on the same page about who is here, why we're here, and what we're looking to gain from our time together, I'm going to turn it back over to Pradeep so we can dive into the presentation.
Thanks, Lamika. Okay, so let's start by explaining what we mean by a research concept. When we use that term, we're referring to the main idea behind a research project. So it's the core question or gap in a scientific study will try to answer. So in this case, we're trying to fill gaps relevant to CARB's mission of protecting Californians from the harmful effects of air pollution, and fighting climate change. So your feedback on the research concepts will shape the scope of work for the research contract that CARB's going to release. We're planning to invest around $1 million in this project, and I'll echo Lamika's point on not hesitating to share your ideas. The more honest feedback we get through meetings like this, the more effectively we can use public funds to move science forward and protect the people of California. So cumulative impacts matter for many reasons. We understand that people are exposed to multiple pollution threats and community stressors. Uh, Developing new approaches through robust science lets us characterize a population's vulnerability or resilience. So agencies can use that information to close health and opportunity gaps between communities. Better understanding cumulative impacts also informs efforts to help communities, for example, through allocating resources, enforcement, permitting, and regulatory actions like that. So let's start with some existing definitions. It's important how we define this term because every person, regardless of where they live, is exposed to multiple threats, and we can only fix what we identify and develop tools to measure. Of course, we're not the looking at factors. Of course, we're only looking at factors related to CARB's mission. And I would note that there are many agencies in the state working to address cumulative impacts. So, the California EPA or Cal EPA, their definition covers exposures or effects on public health or the environment from all emissions or discharges in an area, including those that may be routine, accidental, or otherwise. So this definition acknowledges elevated risk to populations that are sensitive or also experiencing socioeconomic or other environmental stressors. Cal EPA developed this definition as part of creating the first cumulative impacts mapping tool, or CalEnviroscreen. So that's part of our broader effort to lift the unfair burden of pollution from those that are most vulnerable to its effects. And I'll talk about CalEnviroscreen more in a minute. The US EPA's previous, I should say, definition is the totality of exposures to combined chemical and non-chemical stressors and their effects on health, well-being, and quality of life. Both definitions are similar and point to the total burden, looking beyond a source by source approach. And just recognizing that every person, the minute they wake up, is exposed to multiple sources of emission. We should also keep in mind that these definitions may work for now, but they can and should adapt going forward. As we're looking to the future, we'll see different sources of emissions and evolving stressors on communities. And the ones that we're concerned about now may not be what we need to worry about in 20 or 30 years. CARB is committed to move beyond the status quo of fossil fuel dependence, and we're also committed to achieving our public health mission as we move towards that goal. You may be familiar with some of the tools available to screen for cumulative impacts. First, there are the mapping tools. Our sister agency within Cal EPA, the Office of Environmental Health Hazard Assessment, which you may have heard of referred to as OEHA, developed and maintains CalEnviroscreen. This is a mapping tool that combines 21 indicators of pollution burden and vulnerability to assign a single score. So that's what's shown in the legend here to every census tract. The 21 indicators include exposures to air and drinking water pollutants, pesticides, traffic impacts, hazardous waste and cleanup sites, and also population vulnerability like higher health risks, housing burden, and poverty. CARB and other Cal EPA departments support the maintenance and development of CalEnviroscreen. And in fact, shout out to OEHA for releasing the newest version of the tool, CalEnviroscreen 5.0, 2 days ago. So this latest update covers new census data, population data, refined methods, and two new indicators, diabetes prevalence and small air toxic sites. So they are accepting public comments on the update through April 1st. Moving on, there are similar tools at the federal level too, but I would note that the tools from the US EPA and the White House Center for Environmental Quality were taken down around this time last year, and as of this week, are still unavailable. Second, there are frameworks by federal, state, and local agencies. I'm including a couple of examples here. New Jersey's Cumulative Impacts Assessment tool, which includes mapping, is quite distinct. The US EPA has an interim framework released in 2024, and this is the agency's first comprehensive policy guidance on incorporating cumulative impacts across permitting, remediation, enforcement, and grants. The National Academies also developed a report on the state of science and recommendations for US EPA's Office of Research and Development. That office is in the process of being eliminated. So I don't believe there'll be a final publication of the report, but a draft version is available. And if you're familiar with that document, you'll see later that our concepts draw heavily from its research recommendations. This is not an exhaustive list. There are other recommendations too in the links that we're sharing in the chat. The third approach is there are community-based ways that supplement a top-down analysis in regulatory agencies. So these are new approaches where like priorities and decision-making power is shifted to communities. CARB created the Community Air Protection Program in response to Assembly Bill 617 or AB 617. So in this program, CARB and the California Air Districts work with community members, community-based organizations, industry, local agencies, and other stakeholders to develop programs and plans that reduce emissions and exposures in the most impacted areas. AB 617 was signed in 2017, and as of 2025, that program has allocated over $1.6 billion to air districts for incentive projects, and also around 400 million between community air grants for air monitoring and capacity building and to implement emission reductions program. So the blueprint for the program has more information, and we've also shared a case study of AB 617 implementation in the West Oakland area in the chat. The US EPA also has an environmental justice collaborative problem solving program. Their Office of Environmental Justice launched this in 2003 to support community-based nonprofits to develop and implement solutions to local environmental and public health issues. This was only partially implemented as that EJ office was eliminated last year, and we're not aware of the current status of this program. So that brings me to what my team does. Here in California, like in many other parts of the world, we're working to develop a more comprehensive understanding of the costs of pollution to people's health and the economy. As I mentioned before, we are the health analysis team at CARB. Our team analyzes every regulation, plan, or program over a certain budget threshold proposed by CARB to estimate health benefits. We then work with our economic team to value those benefits. Historically, the monetized analysis of regulations has focused more on costs to industry than costs to public health. So we need to expand our health tools. In 2020, this board adopted a resolution directing us to expand this analysis, including new health endpoints and methods to better evaluate impacts in all communities. including disadvantaged communities. So currently, we estimate how changes to fine particulate matter, or PM2.5, affect 12 health endpoints. Originally, we evaluated four, including cardiopulmonary mortality. In 2023, we expanded to include endpoints in cardiovascular, respiratory, and neurodegenerative diseases and incidence of lung cancer. We also evaluate measures of productivity like work loss days. We're in the process now of considering cardiac arrest, stroke, hay fever, and minor restricted activity days. The process to select these endpoints and the methods to quantify them across California over the lifetime of a program or a regulation is based on rigorously vetted scientific evidence. We've relied heavily on work by the US EPA to review and synthesize the latest and relevant science. As of this month, US EPA has stopped calculating the cost in healthcare and the value of human life saved from reducing air pollution, as Bonnie mentioned earlier. So they're only estimating the cost to industry and leaving out the cost to public health because, in their words, the science is unreliable. So that's why CARB is stepping up to take more leadership in this area. And one of the ways we're doing that, one of the ways that we're trying to make up for that loss of federal progress on science is by relying on our own research. There are broad efforts across CARB to fill gaps left by US EPA's new direction. Within our health branch, we have research contracts studying how air pollution affects multiple health outcomes. Right now, we are looking at metabolic diseases like diabetes, birth outcomes, cognitive decline, student test performance, life expectancy across generations, and more local impacts like respiratory medication use near train and port emissions in Southern California. Moving forward, we're looking to expand the research into how combining multiple climate stressors like extreme heat, wildfire smoke, and air pollution impact. So combining how all of those impact public health. We're also looking at how local socioeconomic determinants of health drive the health impacts of air pollution. You can see the full list of our research contracts, active research contracts on our website. The health research is a component of CARB's research program, which has a legislative mandate to develop sound, evidence-based science to support the board's policymaking. Last fall, our board approved a 5-year strategic research plan for this program. So this plan is a product of CARB's long-standing focus on improving reliable evidence to effectively and sustainably address the big challenges that we're facing in air quality and climate change in California and beyond. The development of this plan included meaningful engagement throughout the state from community-based organizations and tribal organizations through public surveys, public meetings, and 7 in-person regional roundtables. So in those conversations, a recurring priority in health research that communities asked for was in cumulative impacts. So that's why we're working on this now. The plan includes research priorities across all areas that support the board's work in the formation of pollution, impacts from dairy and agricultural operations, health effects from wildfire smokes and air toxics, greenhouse gas emissions from natural and working lands, mobile source monitorings, and so forth. One priority included in the health section is cumulative impacts, and specifically, the plan includes research questions that focus on multiple pollutants and multiple stressors, including those from air pollution and climate change across all of California and the communities bearing the greatest burdens. If you're curious, the health section of the research plan starts on page 27. Within our team, this work will be managed by Joshua Monfalcon, as I mentioned earlier, and now I will hand it over to him.
Thank you, Pradeep. Good morning, everyone. My name is Josh, and I'm an air pollution specialist for the Health and Ecosystem Analysis section, and I will be managing the contract for this research. So I'll start us off by going over our outreach process. Given how different each community's experience is with cumulative impacts and how many methods there are to evaluate them, we took a more extensive and collaborative approach to developing the research concepts in this area. So last fall, we began by identifying academic institutions, agencies, and environmental and community groups working in and alongside overburdened communities. We made a list of over 60 institutions, including universities, government agencies, and community-based organizations, to capture diverse perspectives on cumulative impacts from both research and commu community expertise. From there, we reached out to subject matter experts, including epidemiologists, toxicologists, researchers, and community leaders, and held over 40 one-on-one conversations, exploring how each expert thinks about cumulative impacts and the research gaps and exposures and stressors that affect health. And throughout this 5-month period, this process, we have been summarizing the ideas from the one-on-one meetings to adjust the research concepts. From these meetings, we heard several recurring themes, and this word cloud that you see here, it summarizes the most common topics or ideas raised during those one-on-one conversations, and the size of each idea and topic reflects how frequently it was mentioned. Many subject matter experts conceptualize cumulative impacts from a community or regulatory perspective, emphasizing the need to move beyond single stressors toward understanding how multiple exposures, including air toxics and environmental and social factors, combine to influence health. Climate-related stressors were also a recurring concern, including extreme heat, wildfire smoke, and drought. Several experts also discussed how environments like bodies of water and diminishing wetlands can contribute to airborne dust and other pollutants, raising concerns in places such as Salton Sea and similar environments. There was also a strong emphasis on community level and place-based research, noting that exposures vary by region depending on local emission sectors and sources, and that these differences shape cumulative burden for specific communities. More specifically, there was a strong emphasis on moving beyond single pollutants. As Pradeep mentioned earlier, our health analysis right now looks at the impacts from just PM 2.5. And many experts highlighted that for regulatory analyses to better capture the lived reality, we need to integrate both chemical stressors like PM 2.5, ozone, and air toxics with non-chemical stressors like heat, drought, noise, access to healthcare, and so forth. Experts also stress concerns about local sources like ports, rail yards, auto body centers, and agricultural activities as major contributors to the burden in disadvantaged communities, suggesting a place-based approach for the research. Another recurring idea was studying how the timing of the exposure at different life stages impacts health risks, particularly the higher risk during early and later periods of life. To put these ideas more in terms of research gaps, there's a need to move from one pollutant to looking at multiple pollutants together. We also need data at the community scale because averaging across a state tends to statistically obscure the worst impacts. We also need to understand how the built, natural, and social environments change the health effects people experience because of air pollution, which we call effect modification, and we'll talk more about that in a minute. Then we need ways to assess how the age at exposure or exposure over the life course affects health. Based on these gaps, we developed 4 options for cumulative impacts research concepts that can help advance CARB's health impact analysis. These concepts consider the multi-pollutant mixtures communities are exposed to, community proximity to emission sources, local stressors that modify health outcomes, and vulnerability over the lifetime. Each of these concepts represent different lenses for understanding cumulative impacts, and each could contribute to improving the way we estimate health burdens and inform regulatory decisions. Ideally, we could do all this work, but realistically, we have to pick one for the research project. Now, let's look at each proposed concept in detail. So this first concept is focusing on multi-pollutant exposure. Currently, CARB estimates health effects from exposure to PM 2.5 only. We're working towards adding ozone and NO2, but we would still be looking at pollutants independently. In reality, communities experience an atmospheric soup of pollutants at the same time. This concept shifts away from the single pollutant model and instead looks at pollutant mixtures or clusters. Down the line, the results from this concept would allow us to estimate health burden based on exposure mixtures in communities. To keep this analytically feasible, the focus would likely be on broader health outcomes such as mortality. The work would answer questions like whether the health impacts from multiple pollutants are simply additive, compounding, or something else, and if certain mixtures are more harmful for health than others. So for this concept, we could have an epidemiological study comparing two populations with similar levels of PM 2.5 and ozone, but maybe different local mixtures of pollutants from nearby sources. So for example, a portside community may experience higher exposures to volatile organic compounds or VOCs from port and industrial emissions, while another community with similar PM 2.5 and ozone may have lower exposures to VOCs. And these differences in pollutant composition could allow us to compare these exposures by their relative clusters and evaluate whether communities with different pollutant compositions experience different health outcomes. While the first concept focuses on multi-pollutant exposure, the second concept approaches cumulative exposure from the perspective of community proximity, or how far they are to sources. Rather than focusing on pollutant mixtures, this concept will look at community proximity to combinations of emissions in the area. The land use, traffic, commercial, and industrial activity, along with natural emissions in an area, drive the cumulative exposures in any given place. CARB already has SNAPs, or the study of neighborhood air near petroleum sources, which puts state-of-the-art air quality monitors in communities proximal to oil and gas operations to assess exposure to all nearby sources. This concept would expand on that idea by looking at multiple types of emission sources near a population. Because proximity is the independent variable here, we can capture non-chemical effects from facilities like noise, and we can answer questions like, are certain combinations of emission sources particularly worse for health outcomes? For example, let's say for an area like Southern California where there are many emission sources, such as freight corridors, freeways, yards, ports, and oil refineries, we can look at two identical populations with similar demographics and socioeconomic characteristics that are experiencing the same level of PM 2.5. One population is located near industry or refineries, but far from traffic, while the other is located near traffic and far from industry or refineries. Despite experiencing similar levels of PM 2.5, the composition of the pollutants, exposure patterns, and co-exposures differ due to the differences in the emission sectors nearby. This approach would allow us to evaluate whether similar populations experience different health outcomes based on the mix of sectors nearby. The third concept focuses on effect modification, specifically how non-chemical stressors change the health impacts of air pollution. Right now, we look at the direct relationship between a pollutant and a health outcome. But two communities with similar pollution and population can have different health outcomes because of environmental and social stressors. So this concept will focus on how stressors like green space, drought, healthcare access, housing conditions change the effects of air pollution. The focus for this concept will be community scale and not statewide, and can use both quantitative and qualitative methods. This work would help us identify which stressors amplify air pollution related health effects and can help prioritize mitigation or interventions. Many studies treat non-chemical stressors, such as access to healthcare, green space, and housing, as factors to adjust for, rather than looking at how they change or modify the health effects of air pollution. In portside communities, which experience pollution from freight equipment and truck traffic and local industry, this can hide how those conditions can change air pollution-related health outcomes such as asthma. Looking at these community factors can help explain why populations with similar air pollution levels can, for example, have higher rates of asthma depending on the non-chemical stressors they experience. Finally, for the fourth concept, this is looking at air pollution exposure and outcomes through a life course perspective. A lot of epidemiological evidence relies on exposures and health impacts in adults, but a child and an adult experiencing the same stressors for the same amount of time can have really different health outcomes. This concept would explore whether exposure during sensitive periods, such as pregnancy, early development, childhood, and older age, leads to different health outcomes. It can also consider how comorbidities that occur at different life stages modify air pollution related health outcomes. Ultimately, this work would help us understand windows of vulnerability and how repeated or long-term exposure over the life course contributes to cumulative health impacts. For example, in areas such as Central California, which have a high cumulative air pollution burden from freight operations, industry, and freeways, and a large number of schools, daycare facilities, and hospitals nearby. Using a life course approach, we could use existing air quality and health data to examine how chronic long-term exposures relate to outcomes such as childhood asthma or adult cardiovascular disease. We could also examine health outcomes associated with exposure during different life stages and age groups, such as during pregnancy or early childhood. This could help us see whether cumulative health impacts are driven by long-term exposure, vulnerability during life stages, or both. And with that, I'll hand it over to Pradeep, who will lead us through the Q&A.
Thanks, Josh. So here are all four of the concepts again. And yeah, now we'll open the floor up for questions and feedback. So if you have a question, you can type it into the Q&A. If you want to speak, you can raise your hand to be added to the speaking queue, and we'll unmute you when it's your turn. Recognizing that this is a big group and we have limited time, we're asking that you limit your questions to around 1 minute, just so we can give everyone a chance to share their thoughts. If you have detailed questions, please use the Q&A. That'll give us more time to give a full answer. Okay, so to raise your hand, you can click on the raise hand button at the bottom. If you're on the phone, you can also dial *9.
We also do have questions on the Q&A if you want to get started with this.
Oh, sure. Actually, I see Jason has his hand up, so let's start with him. Jason, you can unmute and go ahead.
Thank you, Pradeep and Josh, and also the COB for this wonderful presentation about the research concepts. So my issue is you have different definitions of the cumulative impacts. So over here, for the two types of definitions, you have one is only basically method one based on carb is the chemical
Hmm.
stresses. And the second one, you have chemical and then non-chemical. So that's based on the EPA um, content. So, but based on the slide over here, is it you would focus on the chemical stresses, use other ones like non-chemical stresses, like vegetation, noise, crime, those kind of things as effect modification. That might be a way you can incorporate both of them into one proposal. But Josh
Hmm.
was saying if you go or you add effect modification, you cannot do statewide study. I think that might be wrong. You can still have effect modification. You can connect those data at a very fine spatial resolution at local level across the entire California. So you can still do that.
Right. I think just to clarify that point, uh, yes, you're right that we can still do a statewide analysis with effect modification. But with the third concept specifically, we would want a really granular list of effect modifiers that would that we're at this point thinking would make sense by focusing on specific communities. So we'll likely pick like 3 or 4 different regions of the state to really understand what matters there, what drives the effects there. So certain things in one part of the state may not be relevant in another. So that's why we're breaking these out that way. Does that make sense?
I would just add that, yeah, we're open to considering chemical and non-chemical stressors if that's the crux of the question.
Hmm.
Pradeep, I see we have 9 open questions in the chat and then several hands raised. So if you'd like, I
Yeah.
can assist with maybe alternating between folks who have their hands raised and then reading some questions in the chat for you all to respond to.
Yes. Let's do
Great. So thank you. I think that was it, Jason, who just spoke.
it. Hmm.
We'll move on. The first comment that I see in the chat is it's a comment, not a question, but it came in anonymously. It says, respectfully, we should be able to agree these pollutants harm people rather than allow these communities to continue while communities get studied. And I think I saw a correction to this a little bit later in the comments. Um, but yes, it looks like someone is saying that yes, these studies, should happen, but we all should be on the same page that pollutants are harming uh, the communities, and that also needs to just be acknowledged. But it was anonymous, so I don't know if the person who shared that would want to share any additional thoughts on what they meant by this statement. The next question in the chat in the Q&A says, what data sources will you use to measure air pollutants? What kind of efforts will CARB do to disseminate data? And this came from an anonymous participant.
Sure. I can start with that one. So the data sources for measurement will really depend on which concept we are able to move forward with. So things like the spatial resolution that we need and the temporal resolution we need for the data would affect a lot of that. And we have other divisions within the agency that have mobile measurement labs and also stationary, long-term stationary monitoring as well. So the scope is what will determine the data sources. And I think the second part of the was how will CARB disseminate the data? So that'll again depend on what data we collect, unless we're using or existing monitoring data, which are already publicly available through CARB. Bonnie, did you want to add anything to that?
No, I think you covered it. I mean, this is a preliminary discussion presenting broad concepts. And so we're really excited to get all your input on these broad concepts. And as we get into incorporating all that input and distilling the concepts into specific questions, then and putting that out as a solicitation, then we would get more specific idea about the methodology and the data sources, which is basically a condensation of what Pradeep said. Thanks.
Thanks, Bonnie. Thanks, Pradeep. I see Rich Blostein's hand. If you could please unmute and introduce yourself and share your question.
Yes, my name is Rich Blaustein. I'm a correspondent for Climate Brief, which is published by the Continuing Education of the Bar of California. Thank you for this very excellent and informative presentation webinar. My question is, could you maybe perhaps give specific examples of CARB or California regulations where cumulative impacts are already specified, and also what regulations might in the future be targets for or priorities for including cumulative impacts? And specific regulations would be helpful. Thank you.
Bonnie,
Jump in and just, I really appreciate that question. That's a big question. I would say the first thing to remember is that our cumulative impacts tool at Cal EPA and that CARB uses is Cal EnviroScreen, as Pradeep mentioned in the presentation. And that's an amazing tool that's being updated and that gives us a lot of information. And it's already being used to help focus resources in communities that need assistance and to help focus enforcement efforts. And it's in statute as a key way to identify the most overburdened communities. So we're really pleased and proud to have that tool in California. I know other states are working hard to develop similar tools, and a lot of folks are working with other states to help them in those efforts. In terms of this research, we want to develop more information to inform our research, our health and our community projects, and specifically to help inform the analysis that we do. We mentioned in the presentation that we do health analysis of rules and programs. We do a quantification of the health benefits of every rule and program that goes to the board. We calculate avoided deaths and avoided hospitalizations and emergency department visits, and we're expanding all those outcomes we calculate. So, we want this research to help inform our process of health analysis as we go forward. So we obviously, until we develop the research and keep moving forward, I can't give you those specifics, but we do want to look at broadening the tools we're using in our health analysis and be able to provide more information, both quantitative and qualitative, to the board and policymakers on the benefits and health impacts that we see from air pollution and from the rules we're developing. Thanks.
Thank you.
Thank you, Michael. Thank you, Bonnie. I'm sorry, Michael is there now. I think once people drop their hand, I can't see them anymore. Apologies for that. But I wanted to just also point everybody to the question and answer at the bottom of your screen. Some questions are being answered in the question and answer itself as text rather than out loud. So I would encourage you to take a look at those questions as well and see the responses that the CARB staff are sharing with those. There are many that have already been answered in the chat. I'm going to turn it over to Michael Schmeltz, before we get back to the questions in the chat. Hi, Michael.
Hi, thank you. Michael Schmeltz. I'm here in my role as a public health professor at California State University, East Bay. My question is about The role of community-generated data and community input in these research concepts, I would say, and I'm broadly speaking here, in the past, community input has generally been researchers may ask the community what they think are indicators, and then researchers would find an already, published data set of those indicators and use that as a or some proximity or something similar to what the community had identified, as opposed to using community-generated data. And I'm wondering, with these concepts, are you requiring researchers or whoever goes for this proposal to use community-generated data, or what is the role of the community in um, sort of helping to identify cumulative impacts from their perspective?
Bonnie, would you like to respond to that?
Sure. Thank you. That's a great question. And that's exactly the kind of input that we want to receive today. Um, I can say that community engagement is going to be a key component of the research project, the research solicitation that we develop. We understand that community involvement can inform our research questions and help make sure that we are looking at a broader range of data sources and incorporating lived experiences and priorities. I can't tell you specifically at this point what are the approaches we're going to use in the research solicitation, but I'm hearing your suggestion that we need to incorporate community sources of data. And that's really helpful input. I wanted to say that we have, because I think this kind of covers maybe some other questions. We have been increasing, at CARB, we have been increasing community engagement in research over the past 5 years as an important goal. And this is an important goal for our division. And we have lots of different ways that we incorporate community engagement in our research projects. For example, some research contracts have community subcontractors. Sometimes we have advisory or technical advisory groups. Sometimes we have direct outreach and engagement, community science. There's lots of ways that we incorporate communities depending on the research questions. So we're going to be looking at all these approaches and building some of these approaches into the solicitation. And of course, then, as we work with the contractor that's selected, we'll be refining, what exactly the community involvement will look like. So yes, this is all very important. This input is helpful, and community input will be a priority going forward with this. Thank you.
Thank you, Bonnie, and thank you, Michael, for that question. I'm going to go back to questions in the Q&A that are typed in. So Teresa Trong from CDPR asked, how do you envision translating analysis results into tangible outcomes? And I see that Feng Xiao Su from CARB would like to answer this question.
Yep, go ahead, Finchao.
I think this question is also there's another similar question from Alvaro Oija, and I will invite our, since this is how we use our result to inform policy, and we imagine that while this is still early stage for this project, but we believe the result of this project will better inform our policy, the health assessment in our policy, which will expand the health risk assessment. Is not just focused on one single pollutant. That will be more broad and more comprehensive health assessment. And yeah, please feel welcome to jump in if my manager, like Pradeep and Bonnie, have any other things to weigh in. Thank you.
I just want to say, yeah, we want this research to be both contributing to the science on cumulative impacts and informing our policy and our work at CARB. And I think we've kind of talked about some of the ways, and Feng Chao just mentioned some. Again, I think this is getting into some level of detail as we get into designing the specific research concepts and questions. But yeah, we want it to inform our health analysis. We want it to provide information that we can use as we're evaluating our rules and programs, and as we're providing information to the public about the health impacts of air pollution. We want to be able to continue providing a broader, more comprehensive understanding of the health impacts of air pollution, and just contribute to the work of our agency, where we're coordinating across Cal EPA. We're coordinating with our partners. Thank you, Alvaro, for your question at OEHA. We're going to continue this cross-agency collaboration, and we're working closely with our leadership at CARB because we want this to be policy relevant. Thanks.
And just programmatically, given the number of questions that we have open, so that tells me that a lot of people have a lot of questions and ideas. So I think we should allow for time for people to expand on those in the guided discussions. And maybe we'll take a couple more questions, Lamika, and then.
Sounds good. Thank
Yeah.
you. Yes, and thank you, Feng Xiao, for your response to Teresa's question and Alvaro's question. I'm going to mark those as complete. We did have, I wanted to get to the next question in the chat, and then I see Susan. Hey, Susan. We know Susan. I'll get to Susan immediately after this one. So Julia A. Walsh said, monetizing the health impacts is important. EPA developed, it looks like it's Freddie. Is CARB or other agency using this or modification for California?
So I am going to pass that question to Arash, who is our air resources engineer.
Thank you, Pradeep. So what we do is to calculate the monetization for the health effects of criteria pollutants, such as PM, that we are currently estimating. And for that, we follow EPA monetizations and adapt it for California based on counties, cost of living, and income. So we follow EPA methodology and we just adapt it for California.
Excellent. Thank you, Arash. Susan Nakamura from South Coast AQMD. Hi. Susan, are you able to unmute?
There we go.
There we go.
Hi everyone. Susan Nakamura, South Coast Air Quality Management District, Chief Operating Officer. So thank you very much, Carb. I like all of the four concepts that are presented here. But I think that from an air quality agency and sort of, the focus of where sort of the research, hasn't been done yet would be in number one in the multi-pollutant exposure. Proximity to, sources, life course assessment are kind of built in already when we look at some of the work from OEHA and the effect modification. I think we all understand that there are certain communities and their exposure that they're in the overburdened areas that the stressors are going to impact them even greater. But the multi-pollutant number one to me would be one that it's like not really well studied. We don't really have the methodologies to estimate what that is. I would maybe even suggest that you think about other types of toxic air contaminants with that. PM is not kind of a equally distributed type of contaminant. It's like, DPM is going to be much more concerning than other types of PM. So just, kind of putting that out. So I think my suggestion would be focusing on number one.
Thank you.
Thank you so much, Susan. Oh, sorry, Pradeep. Go ahead.
No, that was it.
Excellent. Thank you. And Susan, when we get into the breakout groups, it would be great to hear more about what specifically in, your ideas about how we can do that in the concept for number one.
Absolutely.
All right. Thank you. We have Yukian Lam from Tishman Center. Welcome.
Hi, everybody. I'm Yekian Lam. I'm at the Tishman Center at the New School, and we are a research and policy kind of center at the New School that accompanies a lot of environmental justice communities. So I just wanted to say that up front. And I wanted to speak a little bit to the comment that was made at the very top, I think anonymously, about, can we not just agree that there is harm from cumulative impacts and kind of move on from there? And I, that comment really resonates with me and kind of with the experience that we've had accompanying a lot of environmental justice groups. And what we've been seeing in New Jersey and New York and elsewhere, this mindset of we can only fix problems that we have the tools to measure, which was kind of stated at the outset, is very related to the excuse that communities often have to put up with, right, from polluters who are justifying, why disproportionate exposures can continue, right? We don't have the methods, there's not enough science. Like we hear that refrain over and over again in these permitting battles, in these other regulatory battles, and it's extremely frustrating. But the thing is, when you make these decisions without accounting for cumulative impacts, you are by default assuming that there is no cumulative effect, right? You're assuming that there is no synergistic effects. So it's not that, no assumptions are being made or we shouldn't be making assumptions. You are making assumptions anyway. So that is something I just kind of wanted to echo. And that kind of leads a little bit to the recommendation that I would have, which is that, whether it's as a subsequent phase or maybe it's an additional concept, I think we would encourage you to look at policy and regulatory ideas for incorporating cumulative impacts in kind of near-term decision making. And that itself is a research question, right? This policy and research question. And there's really great examples of research in this vein. And I believe Charles Lee is on this call. He was a special guest editor of an issue in the Environmental Justice Journal, which just came out on actually how to translate cumulative impacts into policymaking, right? So there's some really great policy ideas in there. There's some really great examples of scholarship. So I think, this could really be interesting as an additional concept. And then the other comment, I think that was a bit about like how communities participate in the solicitation and the research efforts. I do want to point folks to, there was a Health Effects Institute cumulative impact related solicitation that came out a while ago. And I was part of the advisory council that helped to give some feedback on that. We thought very long and hard about, how do you encourage these research collaborations to really be in true partnership with communities? And so there are some ideas there that I would encourage CARP to look at. And, really just thinking as, what is really a good model for academic community partnership. And I'll leave it at that. Thank you.
Thank you, Yukian. Excellent points and appreciate the advocacy as well. Thank you so much. I don't know if anybody from CARB wanted to respond. I think it was more of suggestions rather than a question, but I want to open it up in case any of you would like to.
Great points. We appreciate that. We're a sponsor, one of the many sponsors of Health Effects Institute, and really appreciate their work. And are definitely, we're taking input from the research community in California and outside of California, and HEI is certainly one of those partners that we work with very closely. Thank you.
And I would just quickly add that to the point about like, being able to measure and characterize things. So ultimately, as the research division within CARB, our contracts are intended to expand our regulatory impact analysis, right? So we need defensible quantifications that we can include in supporting documents of that evaluating programs. So that is why I mentioned things that we need to measure. But of course, we understand that there is not going to be a perfect model or a comprehensive assessment that can truly capture. I mean, that's incredibly hard to implement. But what we're trying to do here is to just get one step closer to that. Cool. Should we take one more and then?
Yeah, Pradeep, I was going to suggest because there are a couple of folks who asked a similar question in the chat, and I got a private message, and I want to make sure we hear from Asha as well. I hope I pronounced your name correctly. Great. So let's, because I just saw a question in the Q&A. It looks like maybe it was answered, but I received a similar question privately to me. It says, what is the supposed length of this study? This type of study typically lasts for 2 years. However, it is very hard to have it done in 2 years, given the time required to have funding and personnel in place to start the work, and the 6 months ahead of deadline to have a draft developed. And I think someone else in the chat also asked about the expected length of time for the study.
Mhm, mhm. Right. Yeah, that's a great question. So typically our research contracts tend to be about 2 years. But given the broader scope, I mean, we've certainly spent a lot more time developing the tentative concepts until now, so far. So given the scope of the work and the budget, depending on which concept we ultimately end up moving forward with, will decide on a performance period, including whether we do it in phases or uh, take a more case study based approach as well. And this will also depend on whether we do a statewide, more of an epidemiology analysis or more of a specific community focused approach.
Thank you, Pradeep. I'm going to turn it over to Asha Sharma now for her question, and then we'll move into our breakout groups. Sorry, Sharma, I was trying to ask you to unmute. Did you get the invitation? There.
Now I did. Thank
Okay.
you. Thank you so much, Asha Sharma. I use she, her pronouns. I work with Leadership Council for Justice and Accountability. We're an environmental justice community-based organization that works with communities in the San Joaquin Valley and Eastern Coachella Valley. A lot of community members that we work with are experiencing the cumulative impacts of both, air, water, and soil pollution on a day-to-day basis. And just wanted to echo the previous comment from the Tishman Center about just how we have a lot of existing research on, I believe, all four of these already. And we know this because we constantly use research data in our advocacy with community members to advocate for better protections. But even having, this research and data, we have not been able to see meaningful improvements in policies or regulations that actually improve conditions on the ground for the community members that we work with. And one major issue is that there's just continued expansions and permitting of polluting land uses in the same already overburdened communities. And, we see this trend really clearly in existing state tools like you all have mentioned, CalEnviroScreen. So I just really wanted to echo the feedback of how this research really needs to be informed by community members and really needs to focus on how we change conditions on the ground and what we can actually do to reduce cumulative impacts meaningfully. I think, again, there's lots of data and research showing how this is negatively impacting the health of residents that we work with, especially vulnerable communities, especially children, the elderly that's out there. And, I think the real question is what we can do to actually start seeing some meaningful changes in state policy and state regulation to improve conditions in those communities. So I just wanted to uplift, I think, some of what's been already raised by previous folks. And again, just really encourage folks to reach out to more community-based organizations who have a lot of experience in these areas. Thank you.
Yeah, no, of course. That's a great point, right? And we're at we're using taxpayer money for this, so we are absolutely cognizant of not reinventing the wheel on a lot of these things or duplicating efforts or not making effective use of existing data sets. And that's actually one of the reasons we started with such a broad outreach. And depending on which direction we end up going with the project, we'll tailor the data collection, information gathering approaches to make best use of what's out there already.
Thank you so much.
Just want to add that I really appreciate and hear those comments. Thank you. I'm totally open to incorporating community involvement and different approaches, looking at all the different approaches that we could use and trying to find the best way to include community input into the project that we pick. Thank you.
Thanks, Pradeep. Thanks, Bonnie, and thank you, Asha, for the comments. And really important to continue to lift up the community and how important the community participation and leadership is in this effort. We've had a lot of questions. If you look at the answered part of the Q&A, there are 28 questions that were answered in about 20 minutes. So kudos to the the CARB team for getting into the Q&A chat. There is one question by Paige Barner that has not been answered, but it looks like Feng Chao is going to answer that question. So I think we can move on because, again, one of the most critical reasons why we asked everybody to be here today is because we want to get your feedback. So everything that you've been sharing is super valuable to this process of developing the solicitation. And we're going to get into some smaller group breakouts so that we can continue the conversation, have more intimate discussion, and get more of your thoughts about what you think CARB should focus on as they develop this research solicitation. What are those gaps, so on and so forth. I think Pradeep had a couple things to say before we get into the breakout groups. Oh, do you want me to just keep going?
Yeah.
Okay, great. Okay. So we do need your perspective. We are going to get into breakout groups here. I'm going to turn it over to Diana. I call her Dianita, known her since she was a little girl from my team to share what we're going to do when we get into those breakout groups.
Hello, everyone. I'm Dianita or Diana. We're gonna put everyone into our breakout rooms pretty soon, but I'm gonna give you guys just the instructions on how to do so. Um, so in these discussions, we're just going to have a diverse array of voices and perspectives that we hope to produce robust conversation and yield valuable input to shape the direction of the research solicitation. You will automatically be sorted into the breakout group, and in each breakout group, there's going to be a CARB member who's going to be help facilitating so that you can see the whiteboard. So for this small group discussion, we recommend that you do turn on your camera so folks can see who you are and you guys can chat comfortably. If for any reason you don't like to be in the room you're in, please come back to the main room and one of us will reassign you to a different room. The room will not be recorded, so you can chat freely. But only the feedback that come back to us will be the one written on the whiteboard. We have sticky notes that Pradeep will show in a minute. So we ask that you please write your responses on them. And then there are 4 questions that we will be discussing in those breakout rooms. They are posted right now on the slide. So which concepts would you like to rank the highest and why? Which concept would help us understand the health risks of Californians? Are the concepts applicable to statewide, regional, or local scales? Are the limits of challenge on these topics? And what equity issues should CARB consider prioritizing the concepts? And if there is anything missing, there is a section for you to put your concept ideas or anything like that.
Thanks, Diana. Yeah, so like she mentioned, we'll automatically sort you to groups. And really quickly, once you're in the breakout room, one of our staff will share a virtual whiteboard, and here's what that'll look like. So it'll walk you through 3 steps. Just really, we wanted you to be able to introduce yourself, but just for time, it might be worth it to just go to the second step, which is answering the questions that Diana just went through. You'll see those questions on sticky notes on your whiteboard, and right next to them are the concept boxes. So for whether you're joining by computer or phone, you can drag a note from like the bottom right corner of where it says sticky note and drop it in the empty concept boxes below. And everyone in the room is going to be collaborating on the same board. So don't worry about like, covering up each other's notes or things like that. We'll sort through them. And unless you put your name on your note, um, all um, all your notes would be anonymous. And if you have trouble at any point using the whiteboards, please ask your facilitator who will identify themselves at the beginning, and or you can just come back to the main session, and you'll have about 25 minutes. If you have more thoughts you want to share, you can send them to us in writing in the next 2 weeks. So we have a public comment period that's open through CARB's website, and it'll be open from today through February 13th, so 2 weeks. We'll post the recording of the meeting on the CARB website, along with a summary of the Q&A that we got and our responses to the questions and any that we couldn't get to during the meeting. And that'll also include our response to public comments sent through the website docket. If for some reason you didn't register for this meeting but joined through a direct link, please put your email in the chat if you want to be included in follow-up emails about the project. And if you're interested in one-on-one meeting with the staff developing the research contract, please email us. We're happy to set up additional meetings. That I would emphasize that this is not the end of this discussion, just a milestone. So we're continuing to refine the ideas. In the next month, we'll take all your feedback and suggestions to refine the concepts. And we're aiming to release the first round of solicitation in the months after that. And our wonderful research planning team in our division will hold a separate public meetings for all the open solicitation. Great. Thanks everyone for joining. If you have any questions, you can reach out to us through this email. Lamika?
Excellent. Thank you so much, Pradeep. And thank you all for joining us today. Thank you for sticking around. For those of you who were able to stick around to the end of this meeting, we appreciate your feedback and your insights. CARB is really committed, as has been stated over and over again, to taking this feedback and shaping a research solicitation that is going to ideally yield results that would, help to address cumulative impacts in our most vulnerable communities, including my own communities that I grew up in and the ones that I work in. So please utilize the opportunity to give more input during this public comment period and question period. Go to send an email to healthimpacts@arb.ca.gov if you would like to share more thoughts and or schedule one of those meetings. We really need your input to shape this the way that we want this to come out for our communities. So with that, have a wonderful weekend, everybody. Please take care of yourselves, be safe, and we look forward to more conversations down the line. Like Pradeep said, this is just a milestone, not the end of the conversation. Thank you. Take care.
Thank you.